Fecundity is the size of the fuel tank, your biological capacity to reproduce. Fertility is the fuel you actually use, the actual measured number of live births. According to the latest sample registration system data, India's total fertility rate is 1.9. On average, Indian women are having fewer than 2 children, placing the nation below the mathematical replacement level. Yet, even with sub-replacement fertility, the population continues to expand, recently surpassing 1.4 billion people. Resolving this paradox requires looking past simple averages. We have to examine a hierarchy of 8 epidemiological metrics, each designed to strip away demographic noise and reveal the true growth trajectory. The starting point is the crude birth rate, or CBR, total live births divided by the mid-year population, multiplied by 1,000. India's CBR is 18.3, classified as low, but the limitation is the denominator. Using the entire population includes men, children, and the elderly, groups with zero biological potential to give birth. Because the crude birth rate dilutes its data with these non-reproducing populations, it cannot accurately model future growth. It requires a more specific denominator. We refine the calculation by moving to the general fertility rate, or GFR. Here, we keep total births in the numerator, but replace the denominator with the at-risk population, women aged 15 to 49. Since women in this age range typically constitute about 1/4 of a total population, a country's GFR is generally 4 to 4.5 times its crude birth rate. However, the GFR still assumes that every woman in that 35-year window has the same mathematical probability of giving birth. It fails to account for the peak years of biological fertility. To solve this, we use the age-specific fertility rate, or ASFR. It divides the reproductive window into 7 distinct 5-year intervals. Plotting these creates a bell curve. In India, fertility peaks in the 20 to 24 age group, mapping where reproductive output is concentrated. While ASFR is biologically accurate, monitoring 7 different numbers makes comparing different nations difficult. We need to condense these data points into a single summary number. By summing all 7 ASFR values and multiplying by 5 to cover the 5-year spans, we arrive at the total fertility rate, or TFR. It is important to note that although it is called a rate, the TFR is technically a ratio. It represents the average number of children born per woman. The critical threshold for a stable population is a TFR of 2.1. This is the replacement level. The 0.1 above a simple 2-child average is necessary for 2 reasons. First, the human sex ratio at birth is naturally skewed toward males, with roughly 105 boys born for every 100 girls. Second, the 2.1 figure provides a statistical buffer for child mortality, accounting for children who do not survive to reach their own reproductive years. While the TFR is a powerful summary, it counts both sons and daughters. It cannot specifically track whether a generation of mothers is producing enough daughters to replace themselves. To find that answer, we use the gross reproduction rate, or GRR. This filter strips male births from the TFR, isolating only the female offspring. In India, the proportion of female births is approximately 0.478. Multiplying the TFR by this factor yields the GRR. However, the GRR assumes every born daughter survives until age 49. In reality, this is not the case. To account for this, GRR is processed through a filter adjusting for maternal mortality, resulting in the net reproduction rate, or NRR. The mathematical relationship here is constant. The net reproduction rate will always be less than or equal to the gross reproduction rate, as mortality can only decrease the surviving population. When the net reproduction rate reaches 1.0, each mother is replaced by exactly 1 surviving daughter, marking the definitive point of generational stability. These primary metrics require precise birth registration. In areas where vital statistics are incomplete, we use the child-woman ratio, a proxy based entirely on census data, comparing children under 5 to women of reproductive age. We also monitor the couple protection rate, which tracks the percentage of eligible couples using modern contraception. The couple protection rate has a direct inverse relationship with fertility. In India, this metric is heavily influenced by female sterilization, accounting for nearly 38% of all contraceptive methods used. While the previous 6 indicators measure biological output, the child-woman ratio and couple protection rate provide the programmatic context that explains why those numbers are changing. This data clarifies our initial paradox. If India's fertility is currently 1.9, why does the population continue to grow? The cause is demographic momentum, a lag effect that spans several decades. This population pyramid shows the large cohorts born when fertility was much higher. Today, those specific cohorts are passing through the peak 20 to 24-year-old ASFR bracket. Even with a lower average number of children per woman, the massive volume of women in this age group ensures the absolute number of births remains high enough to drive growth. Sub-replacement fertility is a delayed course correction. Like a supertanker, the demographic ship takes decades to change direction due to the momentum of the generations already on board. Tracking these shifts requires verified population data. The decennial census provides the primary structural records used to calculate metrics like the child-woman ratio. For annual vital statistics like the crude birth rate, the sample registration system is the recognized gold standard, utilizing a dual recording system to verify every entry. Additional programmatic data, including the couple protection rate and district-level fertility trends, is sourced from the National Family Health Survey. You can organize this hierarchy of indicators with a simple mnemonic. Can good apples turn green? Not really. That stands for crude birth rate, general fertility rate, age-specific fertility rate, total fertility rate, gross reproduction rate, net reproduction rate, and replacement. This hierarchy translates abstract population data into actionable health policy, ensuring that public health resources are directed where biological output and systemic reality actually meet.